Okay, let's be honest. The words gum surgery can make anyone a little nervous, right? But what if you knew exactly what it was for and how it all works? Well, today we're going to pull back the curtain on periodontal flap surgery. It's a really precise procedure that can be a total game changer for your oral health. We're going to cover what it is, why it's even needed, and what you can really expect. So, first question, why on earth would you ever need gum surgery? It's really important to know this isn't the first thing a dentist tries. Not at all. It's what they consider when you've done everything right. Great brushing, flossing, you're going for your regular cleanings, but there's this deep-seated inflammation that just refuses to go away. Think of it like this. It's calling in the specialists after the first responders have already done everything they possibly could. So what's that tipping point? Let's dive into why a specialist might look at your situation and say, okay, standard cleaning just isn't cutting it anymore. This is when surgery becomes the necessary next step. This slide really gets to the heart of it. At its core, this whole surgery is about two main things: getting access and making corrections. First, it lets the surgeon actually reach and clean areas that are just impossible to get to otherwise. But it's so much more than just a deep clean. We're talking about reshaping damaged bone, getting rid of those deep pockets where bacteria just love to hide, and even prepping the area for future work, like crowns or implants. It's a comprehensive fix. Now, this procedure isn't something that's just improvised on the fly. No way. It's meticulously designed. A surgeon comes into this with a detailed blueprint, where every single incision is planned out to make sure you get the best possible outcome. So what in the world is a flap? The technical definition is right there, but honestly, the best way to picture it is like carefully opening the flap of an envelope to clean something that's stuck inside. The surgeon creates this little section of gum tissue and just gently lifts it up. That gives them a perfectly clear view of the tooth's root and the bone underneath. And that direct access is what makes the deep cleaning so incredibly effective. And that little envelope flap isn't a one-size-fits-all kind of deal. The surgeon has to think about a few key things. Is the goal just to get access for cleaning? Do we need to move the gum line to a new spot? And super important, how do we design this thing to make sure we keep a great blood supply for quick healing? The answers to those questions dictate the exact blueprint for each patient. Okay, so creating that flap involves this really precise three-step dance. First up is the internal bevel cut, which separates the unhealthy inner lining of the gum pocket from all the good stuff. Next, the crevicular cut goes inside that pocket to release the tissue from the tooth itself. And then finally, the interdental incision frees up the gum tissue from between the teeth. It's this methodical, three-part release that lets the flap be lifted cleanly and safely. So the next big decision for the surgeon is about thickness. A full thickness flap means they lift everything, including that thin membrane that covers the bone. It's called the periosteum. You need to do this when the bone itself has to be reshaped. But a partial thickness flap is more delicate. It actually leaves that protective layer right there on the bone. That's the go-to choice when the surgeon just needs to get in there for a good cleaning and isn't planning on touching the bone at all. All right, so we know how a flap gets made, but this brings us to a bigger, more strategic question. Once you're in there and have access, what's the ultimate goal? Well, it turns out there are really two main philosophies, two different paths to healing that a surgeon can choose from. This slide lays out those two philosophies perfectly. The first path is called resective, which you can just think of as remove and reshape. Here, the surgeon actively gets rid of the infected pockets by trimming away tissue and contouring the bone. The second path is minimally resective, or what I like to call access and preserve. With this one, the goal isn't to surgically chop out the pockets, but simply to get access for a perfect cleaning and then let your body's own amazing healing process shrink them down naturally. And a perfect example of that access and preserve way of thinking is a technique called the modified Widman flap. The goal here isn't aggressive removal. It's a very precise, minimal opening, just big enough to get in, meticulously clean the root, get rid of the inflamed tissue that's lining the pocket, and then lay that flap right back down. It's all about encouraging the best possible natural healing with the least amount of trauma. Okay, so once the surgeon's work is all done, the most important part actually begins: healing. This is where your body takes over, and believe me, your role in all this becomes absolutely critical for making sure the results actually last. Your body's healing response is just incredible. It starts right away. Within 24 hours, a blood clot forms a natural little bandage. Then, over the next few days, new surface cells start marching over to close the gap. By the 1 week mark, you've already got a new attachment starting between the gum and the tooth. And after about a month, the area is pretty much fully healed, with new fibers organizing themselves to create a strong, healthy connection. It's amazing. Now, here's a really interesting and important detail about healing. Remember those full-thickness flaps where the bone gets exposed? Well, as part of the body's natural remodeling process, it'll actually absorb a tiny amount of the surface bone. We're talking about just 1 millimeter. This is completely normal, it's expected, and surgeons absolutely factor it into their plan from the very beginning. Of course, with any kind of surgery, you've got to ask about the risks. And the good news here is that the data is incredibly reassuring. Post-op infections, they're surprisingly rare, happening in only about 2% of cases. Seriously, when it's done right and you take care of it afterwards, it's a very safe and predictable procedure. And now we get to what is, without a doubt, the single most important takeaway from all of this. After decades of research comparing all these different surgical techniques, scientists came to a pretty stunning conclusion. In the long run, the specific type of surgery you have doesn't matter nearly as much as what you do afterwards. Lifelong, consistent maintenance, and that means your professional cleanings and your great home care, is the one variable that determines whether you keep your teeth. The surgery isn't the cure. The follow-up, that's the real hero. And that really brings us to our final and most crucial question. It's so tempting to look at a surgery like this as the finish line, right? But that's just not what it is. It's a reset button. It gives you a clean slate. So the real question isn't about the surgery itself, it's about how you see it. Is this the end of the problem, or is it the start of a brand new commitment to your health? Because at the end of the day, that commitment is the only thing that's going to guarantee success.